members and good evening, respected senior members and of the society, TIE, NHM, and other dignitaries. Actually, TNIG plans to bring out all their multi-center studies, which was conducted over last 3 years. So far, we have conducted 3 studies. The main aim of coming out podcast is to reach more number of people as well as more common audience. That is our main idea of why we are bringing out this podcast. I think this is the first podcast we are going to record it. As I said, so far we have completed 3 studies. 2 of the studies has published already, and the 3rd study is on the process of manuscript. And this is the first study where we conducted in 2019 across 16 centers of Tamil Nadu, where we looked into the rodenticide poison ingestion across Tamil Nadu, multiple cities. Subsequently, we also came out with the guidelines for rodenticide poison management, particularly in the resource constraint settings. That is where all these cases were coming into. The recommendation included what we suggest was the hub and spoke model, which is happen in each districts of Tamil Nadu, with special emphasizing on the management of this acute liver failure by the treatment called PLEX, that is plasma exchange. We are highly appreciative of the TIE NHM as well as government of Tamil Nadu to initiate this aspect and hurriedly agreed upon these things and started things are moving. So this is the first recording, and the plan is to have the presentation of the study. Subsequently, we have expert comments and discussions. Thank you. I welcome once and all for the meeting. Over to you, Ipan.
Thank you, Ubal. So this is as Ubal mentioned, this is the first such podcast of discussing the multi-center studies which have been endorsed by Tamil Nadu ISG. And as Ubal said, we hope that this will help reach a wider audience and will have a positive impact in our society at large. So today, the first study being discussed is the rat poison-induced liver failure. And I will start as a first presenter. We're having 2 or 3 talks today following the discussion. So I will share my screen. Let me see if it works. Okay, while we are coming on, may I welcome Professor Marudhurai and Lydia, both of who are from TIE NHM, who have kindly joined today's meeting, and we will be having a presentation by Dr. Marudhurai as well as some comments from Lydia. Dr. Marudhurai is a state program manager of TIE NHM. Yeah.
Okay, anybody from Forts?
Yeah, okay. I think now it's coming, yes. I think.
Sir,
yeah.
Yes, sir.
Okay. So I'll start with the first talk. This is to discuss a bit more in detail what people mentioned about the 2 initiatives by the Tamil Nadu chapter of the Indian Society of Gastroenterology to address deaths mainly in young persons from liver damage caused by rodenticide ingestion. So there are two initiatives here. The first is about the study conducted by across Tamil Nadu, document the magnitude of the problem, as well as the guidelines brought out by TNISG in this regard. So this was the publication which came out in 2021, 1 year ago in August. As you can see, there are about 50-60 authors. So there were many people involved. This was a team effort, and many people from the TNISG, many experts of TNISG were involved in the conduct of the study. So the background to the study was that there has been no systematic study of the magnitude of liver damage due to rodenticide ingestion in India. And the aim was to assess exposure to rodenticide as a risk factor for acute hepatotoxicity in Tamil Nadu. So in the methods of the study, this is a retrospective study of acute liver damage caused by ingestion of a hepatotoxin or a potentially hepatotoxic drug taken as an overdose, and was conducted for the first 6 months of the year 2019, we excluded patients who had drug reaction. For example, anti-TB drug induced hepatitis would not qualify in the study, neither the person with underlying cirrhosis. So there were 15 hospitals which participated in 6 districts of Tamil Nadu. 7 of these were government medical colleges, and 8 hospitals were in the private sector. Now, during that 6-month study period, there were 702 patients recorded in this from the study hospitals who had patients who had liver damage with ingestion of either a hepatotoxin or overdose of a potentially hepatotoxic drug. Now, of this, the large number, 685, had consumed rodenticide, while only 10 had consumed paracetamol overdose. Now, as we know, the Western literature highlights paracetamol overdose as the commonest cause of acute hepatotoxicity in the West. And our textbooks all have that. And all the end of the exam questions are based on that. But in India, at least in Tamil Nadu, the problem is more of rodenticide causing acute hepatotoxicity. And from this data set, the ratio of number of patients who had hepatotoxicity due to rodenticide ingestion is to those who had paracetamol overdose was 75:1. For every 1 patient of paracetamol overdose causing liver toxicity, there was 75 toxicity. Now, in this 180-day study period, 6-month study period, (227 patients, more than 1 patient per day. And same was the story in Stanley, more than 1 patient per day, while Kilpock had 79 patients during this study period. Now, most of the patients were managed conservatively, while 54 underwent plasma exchange and 1 patient underwent urgent liver transplant of this data set. Most of the patients were young, age 25 years, and survival, 1/3, 35% of patients had a poor outcome, either died or were. Okay.
Yeah, from this slide you have to start.
Okay. So the hospital with the highest caseload during this 180-day study period had more than 1 patient per day during the study. And the highest numbers were in Thanjavur, Stanley, and Kilpock in this study. Now, of the 451 patients, majority received conservative management, while 54 exchange, and 1 patient underwent urgent liver transplantation. Now, the most patients were young. The median age was 25 years, and 35% of the patients had a poor outcome. They either died or were discharged in a moribund state. So from this data set, we estimated that across Tamil Nadu, in the first 6 months of the year in 2019, maybe 554 patients would have died from rodenticide ingestion. So we concluded thereby that rodenticide ingestion is an important cause of acute hepatotoxicity in Tamil Nadu. Most patients were young, and 1/3 poor outcome, and there was a need for public health intervention to address this. The second part I would like to discuss is about the Tnisg guidelines to manage rodenticide poisoning, which were brought out in January 2022, this year. So these guidelines were published in this journal. This is our journal, the GHEP journal. I can vouch for the tremendous impact that such a journal carries for us to focus on the problems which we face and to get appropriate resources brought in to address the problem. And this is a classical example. So as mentioned in the introduction in this article, why did these guidelines come about? These came as a response from the Tnisg on identifying a need in our society. So in contrast to developed countries, liver transplant is out of reach, urgent liver transplant out of reach for most patients in India at present. If somebody has to have a liver transplant within a 1 to 2 day time window, Most patients in India cannot access them. So thereby the focus is to maximize survival with non-transplant treatments. So there are two main points in the guidelines, non-transplant treatments. One is to avoid the use of sedative medicines if possible. And two is these guidelines mention the indications and contraindications of the use of plasma exchange to treat acute liver failure. Incidentally, these are the world's first such guidelines. We also propose that in each district of Tamil Nadu, there should be a hub and spoke model, where in a primary care, the idea is to give first aid and remove the poison from the body. Secondary care, where all such patients should be admitted, because the onset of liver toxicity comes on 4 or 5 days after the injection, and the patient looks well initially. So we should always admit the patient, monitor for liver failure and other complications. And those who develop liver failure or liver dysfunction should be referred to a center with specialized facilities like plasma exchange in a district government medical college hospital in each district. So I will end there.